Today we will discuss about cardiovascular system and exercise. These are the objectives for this topic, list important functions of the cardiovascular system, and describe how to use a auscultatory method to measure blood pressure and give average values for systolic and diastolic blood pressure during the rest and moderate exercise. So what is cardiovascular system? It is sometimes called blood vascular or simply the circulatory system. It is the organ system in which the blood is pumped through the heart and circulates throughout the body. So the heart, arteries, capillaries, and veins are the components of cardiovascular system. The heart is a muscle that pumps blood to all parts of our body and provides the force to propel blood throughout the vascular circuit. Myocardium, a heart muscle, consists of striated muscle similar to skeletal muscle. It is found in the walls of all four chambers of the heart, and there are two separate pumps which are right and left heart pumps. Unlike skeletal muscle, individual fibers interconnect in lattice-work fashion. As a result, stimulation of one myocardial cell spreads an action potential throughout the myocardium. Right heart pump receives the oxygenated blood returning from all parts of the body. Pump blood to the lungs for aeration via pulmonary circulation, while the left heart pump receives oxygenated blood from the lungs. Pump blood for distribution throughout the body via systematic circulation. And here's a video showing the systematic and pulmonary circulation.
Blood circulates through the body in two main routes. The systemic circulation transports oxygenated blood to the tissues and brings deoxygenated blood back to the right side of the heart. The pulmonary circulation transports deoxygenated blood to the lungs and brings freshly oxygenated blood back to the left side of the heart. The coronary system is the portion of the systemic circulation that perfuses the heart muscle.
Arteries are the high-pressure tubing that conducts oxygen-rich blood to the tissues. Arterioles is a small diameter blood vessel in the microcirculation that extends the branches out from an artery and leads to the capillaries. Capillaries are small, thin blood vessels that connect the arteries and the veins. Their thin walls allow oxygen, nutrients, carbon dioxide, and waste product to pass to and from the tissue cells. Capillary branching increases the total cross-sectional area of the microcirculation 800 times more than the 1-inch diameter aorta. Veins are elastic tubes or blood vessels that carry blood from your organs and tissues of the body back to your heart. Venous return, a unique characteristic of veins, solves a potential problem related to the low pressure of venous blood. Gas exchange takes place in the lungs' alveolar capillary network, where the pulmonary veins return oxygenated blood to the left heart pump and the journey of the body resumes. This shows that the valves in the veins prevent the backflow of the blood but do not hinder the normal one-way of the blood. Blood moves through the veins by the action of nearby active muscle or contraction of smooth muscle bands within the veins. A significant blood reservoir. Their veins do not merely function as positive conduits. At rest, the venous system normally contains about 65% of total blood volume. Hence, veins serve as a capacitance vessels or blood reservoirs. Varicose veins usually occurs in superficial veins of the lower extremities from the force of gravity that retards blood flow in an upright posture. Venous pooling, something that occurs when you have chronic venous insufficiency. Active cool down. Cooling down with rhythmic exercise facilitates blood flow through the vascular circuit, including the heart during recovery. Blood pressure. With each contraction of the left ventricle, a surge of blood enters aorta, distending the vessel and creating the pressure within it. The pressure wave readily appears as pulse in the following areas: the superficial radial artery on the thumb side of the wrist, the temporal artery, and the carotid artery along the side of the trachea. At rest, the highest pressure generated by left ventricular contraction to move blood through a healthy and resilient arterial system at rest usually reaches 100 mmHg. As the heart relaxes, the aortic valves close and the natural elastic recoil of the aorta and the other arteries provides a continuous head of pressure to move blood into the periphery until the next urge from ventricular systole. During this, arterial blood decreases to 70 to 80 mmHg. Generalized response for systolic and diastolic blood pressures during continuous graded treadmill exercise up to maximum. High blood pressure or hypertension imposes a chronic strain on normal cardiovascular function. If left untreated, severe hypertension leads to heart failure as the heart muscle weakens, unable to maintain its normal pumping ability. During exercise, the alternate rhythmic contraction and relaxation of skeletal muscles forces blood through the vessels and returns it to the heart. Increased blood flow during moderate exercise increases the systolic pressure in the first few minutes. It then levels off, usually between 140 to 160 mmHg. Diastolic pressure remains relatively unchanged.
Blood pressure is the measure of force exerted by circulating blood against arterial walls. It is calculated by multiplying cardiac output and total peripheral resistance. It can change in response to activity, nutrition, body size, obesity, health status, and the presence of blood vessel disease. It is internally managed via baroreceptors in large arteries that can detect changes in pressure and inform the central nervous system to release hormones, which constrict or dilate vessels as needed. We find that during exercise or high-stress situations, that heart rate increases, which increases cardiac output, which in turn increases blood pressure. Pressure increases to a much greater extent in response to heavy weightlifting when compared to aerobic training as seen here. The greater increases during weightlifting are caused by factors such as increases in intra-abdominal pressure, compressive forces from muscular contractions, and compression from external elements such as equipment. Think of the leg press. The Valsalva maneuver, which includes holding of one's breath while attempting to move a heavy load to increase stability, should not be performed among those with hypertension or clinical high blood pressure. It is a dangerous strategy for those with blood pressure issues, as it creates a major additional spike in blood pressure combined with a reduction in heart rate, which can cause dizziness, fainting, or even direct vascular damage among those with compromised systems. Interestingly, blood pressure ties in with assessing a client's pulse, as pressure exerted against the arterial wall at pulse assessment locations during each heartbeat is what we feel when we take a resting or exercise measurement. Large arteries close to the skin can be palpated at the head, neck, arm, and leg, but personal trainers primarily use the radial pulse in the lower arm and the carotid pulse at the neck as shown here. Protocol for taking a resting measurement or during training will be described in detail in a later lesson.
How to measure blood pressure. Blood pressure represents the force or pressure exerted by blood against the arterial walls during the cardiac cycle. Pulse pressure reflects the difference between systolic and diastolic pressures. Blood pressure is measured indirectly by auscultation, which uses a stethoscope and sphygmomanometer consisting of a blood pressure cuff and an aneroid or mercury column pressure gauge. And here are the measurement procedures. And this is the blood classification and management for adults. DBP stands for diastolic blood pressure, SBP for systolic blood pressure, ACEI for angiotensin converting enzyme inhibitor, ARB for angiotensin receptor blocker, BB for beta blocker, and CCB for calcium channel blocker. Resistance exercise. Contrast the blood pressure responses during rhythmic aerobic exercise and intense resistance exercises that engage small and large amounts of muscle mass. Straining type exercise increases the blood pressure dramatically because sustained muscular force compresses the peripheral arterioles, considerably increasing the resistance to blood flow. And I will show you some videos on how this ACEI, ARB, BB, and CCB works.
If your doctor has prescribed you ACE inhibitors such as ramipril and enalapril, it may be because you have high blood pressure or heart failure or have had a heart attack. ACE inhibitors work by inhibiting the mechanism that the body normally uses to maintain blood pressure. Angiotensin 1 is an enzyme in your bloodstream. Angiotensin converting enzyme, ACE, converts angiotensin 1 into angiotensin 2. Angiotensin 2 is an enzyme that narrows your blood vessels and releases hormones that can raise your blood pressure. ACE inhibitors stop ACE from doing this conversion, reducing the levels of angiotensin 2 in your body. Lowering your levels of angiotensin 2 relaxes your blood vessels and reduces your blood pressure to a normal level. Lowering your levels of angiotensin 2 also means more salt passes through your kidneys and takes water with it into your urine. Reducing the amount of fluid in your body means there is a smaller volume of blood for the heart to pump. By relaxing your blood vessels and reducing the amount of fluid in your blood vessels, ACE inhibitors help to control your blood pressure. This reduces the strain on your heart and arteries. If you have heart failure or have had a heart attack, ACE inhibitors may also be used to help improve your heart's muscle pumping action. So, you may be prescribed ACE inhibitors even if your blood pressure is at a normal level. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health.
Hello everyone, today we're going to be talking about angiotensin receptor blockers. These are the medications ending with the suffix sartan. These are angiotensin 2 receptor blockers, so if we want to understand the mechanism of action, we have to see what angiotensin 2 normally does. Normally, angiotensin 2 is secreted from the liver as angiotensinogen, which gets converted to angiotensin 1 by renin, and that becomes angiotensin 2 by ACE, and of course there is a receptor for angiotensin 2. These medications block the receptor and thus block the action of angiotensin 2. This mainly results in decreased blood pressure, as angiotensin 2 normally increases blood pressure. ACE enzyme normally increases blood pressure by two mechanisms. First, it produces angiotensin 2, and second, by breaking bradykinin. So ACE inhibitors like lisinopril will block both of these mechanisms, resulting in significant decrease in blood pressure. Angiotensin 2 receptor blockers like losartan will only block one of these mechanisms, so it's not as effective in decreasing blood pressure. There is also no bradykinin, so there is no dry cough associated with bradykinin, which we see with ACE inhibitors.
Your heart pumps blood around your body through a network of blood vessels, known as the circulatory system. Your blood then supplies the cells in your body with the oxygen and nutrients they need. If your doctor has prescribed you beta blockers, such as atenolol or bisoprolol, it may be because you have an abnormal heart rhythm, or angina, or heart failure, or had a heart attack. Beta blockers work by blocking the actions of hormones called adrenaline and noradrenaline. These hormones make the heart beat faster and with more force. Blocking them makes your heart beat more slowly and with less force, which reduces your blood pressure and the strain on your heart.
Calcium blockers are some of the most important antihypertensive drugs in the market. Why are they important and how do they work? This is what we're going to discuss in this episode of Billboard. Calcium channel blockers are the first-line antihypertensive drugs. Their onset of action is quick due to the rapid oral absorption. Monotherapy with calcium channel blockers is effective in 50% of hypertensive patients. The uses of these drugs are numerous. Some of them are decreasing blood pressure through vasodilation, angina pectoris due to a decrease in myocardial oxygen consumption, supraventricular arrhythmia because of its depressant action on SA and AV nodes, as well as migraine. So how does it work? After entering the bloodstream, calcium channel blockers block the voltage-sensitive L-type calcium channels by binding to specific sites on the A1 subunit of these channels, which are embedded on the smooth muscle cells of the blood vessels, cardiac myocytes, and cardiac nodal tissues. This blockage in turn will lead to prevention of calcium entering these cells, resulting in no excitation coupling reaction in the heart and vascular smooth muscles. The pharmacological results of that mechanism are relaxation of arterial smooth muscles, significant reduction in the afterload on the heart, coronary vasodilation. Examples of calcium channel blockers include amlodipine, verapamil, nifedipine, and diltiazem. A trick to memorize these medications is to remember the phrase, "a very nice drug." No drug is perfect, and that includes calcium channel blockers. The common side effects are postural hypotension, palpitation, reflex tachycardia, edema, and dizziness. The most important contraindications of calcium channel blockers are heart failure, bradycardia, arterioventricular block. Calcium channel blockers are usually well absorbed through the GIT, which means that they go through first-pass metabolism. However, once entered the bloodstream, calcium channel blockers are highly bound to plasma protein. After doing their action, calcium channel blockers are then metabolized by the liver and excreted renally.
The top of each bar represents the systolic blood pressure, while the bottom represents the diastolic blood pressure. Upper body exercise, the smaller arm muscle mass and the vasculature offer greater resistance to blood flow than the larger and more vascularized lower body regions. This means that blood flow to head of pressure and accompanying increases in myocardial workload and vascular strain. In recovery, after a bout of sustained light to moderate intensity exercise, systolic blood pressure temporarily decreases below pre-exercise levels for up to 12 hours in normal and hypertensive subjects. The heart's blood supply, nearly 2,000 gallons of blood flow from the heart each day, but none of its oxygen or nutrients pass directly to the myocardium from the heart's chambers. The myocardium maintains its own elaborate circulation. And this figure illustrates this vessel as a visible, crown-like network, the coronary circulation that rises from the top portion of the heart. The openings for the left and right coronary arteries emerge from the aorta just above the semilunar valves where oxygenated blood leaves the left ventricle. Myocardial oxygen utilization. Oxygen utilization by the heart muscle remains high in relation to its blood flow. At rest, the myocardium extracts 70% to 80% of the oxygen from the blood flowing in the coronary vessels. Rate pressure product. An estimate of myocardial work. Three important mechanical factors determine myocardial oxygen uptake. First, the tension development within the myocardium. Second, the myocardial contractility. And the last, heart rate. This index of relative cardiac work, called the double product or rate pressure product, closely reflect directly measured myocardial oxygen uptake and coronary blood flow in healthy subjects over a range of exercise intensities. RPP computes as rate pressure product equals to systolic blood pressure multiplied to heart rate. The heart's energy supply. The myocardium relies almost exclusively on energy release from aerobic reactions. Not surprisingly then, myocardial tissue has a threefold higher oxidative capacity than skeletal muscle. Its muscle fibers contain the greatest mitochondrial concentration of all tissues, with exceptional capacity for long-chain fatty acid catabolism as a primary means for adenosine triphosphate or ATP resynthesis. After a meal, glucose becomes the heart's preferred energy substrate. In essence, the heart uses for energy whatever substrate it sees on physiologic level.